Hello, my name is Alyssa Spivey, and today I will be presenting my capstone project for Midwestern States University's Department of Nursing for Dr. Christy Bowen. The capstone project is how to improve patient outcomes with education. By the end of this presentation, the viewer will be able to learn the following in regards of the capstone project: the rationale and purpose, the background and significance of the proposal, the PICO problem statement, literature to support the proposal, implementation, evaluation, how are we going to get this information out, and the summary of the project. Now let's go over a brief introduction. Healthcare workers strive to promote and respect the autonomy of every client. Anyone who interacts with a client should consider factors that may impact one's understanding. These factors can include age, education, or even medical disorders. Protocols have been suggested in the perioperative community to help enhance clients' education throughout the perioperative period, such as the Enhanced Recovery After Surgery, also known as ERAS. ERAS offers many other benefits with its guidelines, including facilitating early mobility, decreasing the length of hospital stay, less opioid use, and improving the patient's quality of life. Gumas K. et al. 2020 states that implementing the most up-to-date guidelines of ERAS will help accelerate the client's recovery while decreasing the complication rates. Seeing this program firsthand at the Authors Hospital has shown that there are many breaches that have occurred with the meaning of educating the client. While the guidelines of ERAS do include educating the client throughout the process, the author has noticed the lack of obedience to this component. Educating the client has emerged in the hospital as educating on what the protocol of ERAS is, rather than educating on the actual surgery and perioperative period for the individual themselves. The BSN graduate has seen evidence provided regarding the positive outcomes that ERAS has already provided. Therefore, it is evidence that ERAS has a great foundation throughout the perioperative phases, but the compliance of providing education must be adhered for the client to be involved and to have the correct understanding. The proposal and rationale for the selection of the topic is due to a direct result of the lack of faculty data. The lack of evidence to support that this is a problem within the author's facility simply helped the author realize that this is a topic of concern for those who do not realize that clients do not understand their surgery or what is happening to them. The hospital did provide a great deal of documentation that shows that ERAS has indeed helped with different factors. Implementing ERAS has resulted in a 47% decrease in opioid utilization within 1 year. It also has been shown to decrease the length of a hospital stay by 2 days after a client has received a colectomy. While the evidence can be beneficial to decrease the length of stay and decrease their use of opioids, which ultimately decreases their costs while increasing revenue, where's the evidence that patients understand what actually is happening? While the nurse is performing their preoperative duties, they must ask the client, in your own words, can you describe what you're having done today? And the author realized time after time the client would respond with, well, part of my stomach is being removed, whenever they're really just getting their gallbladder removed, or I'm just having another toe amputated. Well, yes, the gallbladder does play an important role in the stomach and the digestive process. It's not necessarily the stomach that they are removing. And does the client even know why they're getting another toe amputated? Do they understand that this is a result of their diabetes being uncontrolled? The author realized that clients were just simply not educated on what was happening or why it was happening. This is just leaving more room for errors to occur due to the miscommunication. The Joint Commission reported that 60% of adverse events were due to a communication error. Communication plays a crucial role in the management of surgical patients and their involvement and understanding. Now, some background. The concept of enhanced recovery after surgery is established from the collaboration of the interdisciplinary team to enhance perioperative care for clients. Its origin dates back to the 1990s when a colorectal doctor from Denmark published findings of decreased discharge times after introducing a protocol that did not increase any complication rates. These findings were shared over time with several surgical specialties that implemented these findings and creating a pathway. These several procedural groups that did use the enhanced recovery after surgery included cardiac, colorectal, liver, rectal, pelvic, gastrointestinal surgeries, and more. Yet, the enhanced recovery after surgery guidelines cannot be applied to certain surgical populations. So the guidelines are graded through a consensus, and then they're developed into a standardized process pathway. The increase in success when using these studies eventually resulted into the ERAS Society being created in 2010. And we can see that it's a great foundation for improving patient outcomes, but it needs complete compliance in order to be successful. The professionals who generally spend the most time with the patient are the nurses. Therefore, nurses play a vital role in educating and implementing teaching, but they're also not the only professionals who play an impact on the education of the client. The ERAS protocol is required as a part of their perioperative training, meaning that nurses know that it's vital for them to be educated. Now, for the success of enhanced recovery after surgery to be completely achieved, the nurse must know that they need to provide education throughout every operative stage that the client's going through. The foundation of care, such as providing knowledge to clients, encouraging the pathway, and motivating them to play a role in their treatment, are just a few of their key duties as a nurse, and they must strive for it. Healthcare professionals aim to deliver high-quality care as well as recovery satisfaction. According to Filomeno, suggesting an education prior to surgery and after surgery has a positive outcome with clients. The problem question is as follows. In post-operative clients, how does the involvement in the plan of care compared to no involvement in their plan of care affects the patient outcomes within the perioperative phases? This proposal will continue to discuss the possible methods to improve the problem question. Now, multiple themes were found throughout the resources collected. The BSN graduate broke up these common themes into 3 categories: the nurse's role, post-surgery education, and ERAS education. A nurse is a vital role throughout all of the perioperative phases that the client's going through. Therefore, it's important to ensure that nurses are aware of and that they understand the most cutting-edge research and up-to-date information. Guma's case stated that when nurses apply the most up-to-date care following the ERAS protocol, it'll help accelerate a surgical patient's performance and vital functions. This is aligned with another study performed by Wainwright, which explains how vital it is for nurses to be present in the client's surgical journey. According to Wainwright, adherence to the ERAS protocols was poorly implemented once a patient was returned to their unit. This is a vital time for a nurse to help initiate those components of ERAS. Nurses are expected to educate, ensure early nutrition, assist in pain control, and promote the early ambulation to help abide by the ERAS protocols after surgery. Nurses staying up to date with evidence provided by following the ERAS protocols in relation to their role, they may be more willing to implement those components of ERAS. Another theme that was obtained was the relationship of interventions with different types of surgeries. So 3 articles that were obtained included information about post-surgery education with general cardiac surgery, coronary artery bypass grafts, and total knee replacement surgery. These studies evaluated educational interventions and made by the nurse. These studies evaluated educational interventions that were made by the nurse to adequately prepare the clients for surgery. The lack of education is the best overall findings throughout all of these resources. Pugliese performed a meta-analysis including 23 studies that reported less than one-third of the studies involved patients who did not understand their planned surgical interventions. And according to Filomeno, for patient education to be successful in general cardiac surgeries, it is suggested for the multimodal approach throughout every perioperative phase. This aligns with the relationship between the total knee replacement and providing that multimedia interventions is to improve the recovery. This finding goes along with the postoperative findings after a coronary artery bypass graft, which deemed crucial for there to be personalized education to prepare the patient for discharge to aid in the reduction of readmissions. In conclusion, it shows how important it is to ensure that the clients are receiving education that's suitable for their learning style. The third theme that the BSN graduate is able to group together includes education of ERAS and how everyone within the healthcare team must be on the same page to increase the client's outcome. Most of the healthcare team includes the client, the nurse, physicians, and the anesthesiologist. Although one article reported that 60% of physicians even viewed the family members as healthcare team members, and if they're involved, that they will have a potential to improve the quality of care. Harrison believes that the collaboration among the perioperative team members is key in implementing care, and it can even effectively address the intricate perioperative populations. These results show the importance of everyone being on the same page to meet the expected outcomes. While it's important for the interdisciplinary team to be on the same page, nurses must ensure that the incorporation of the patient is priority. There's an increase in satisfaction among clients in the postoperative phase if they receive proper postoperative information as well as being included in that decision making. The common theme is that the increase in the client satisfaction when they're involved in the education of surgery and the plan of care. This is a theme that supports the proposed topic to help make a difference with the perioperative community. This proposal will impact every patient who's undergoing a surgical procedure, as well as anyone involved in the perioperative phase. The BSN graduate believes that the proposal will impact the client by providing a faster recovery, decreased length of stay, fewer pain medications, and increase their satisfaction. This will help the client understand what is needed to be done to take care of their body and understand what's being done and why. The impact of healthcare professionals may be a little bit difficult at first because of the time needed to be set aside for that education. The time spent with the clients will need to be spent with intentional teaching and what exactly is provided. The process of this proposal will slightly mimic that ERAS protocol map by starting with the pre-admission setting and ending after the patient's perioperative period. To implement the interventions, healthcare professionals will carry out 6 steps. The first step would be to develop the foundation with the narrative review. Professionals want to focus on the patients involved in the perioperative period and compare to how things are currently performed and any negative impacts that they may have. The second step is to draft up a set of educational fundamentals that influence postoperative complications. It is important to recognize any common themes that may stand out. Thirdly, we need to focus on the positive outcomes of different types of educational strategies. Everyone has a preferred learning and teaching style, so it's important for us to adapt to what aligns best with the patient. It's also going to rule out methods that may not be most effective. The fourth step will include the elaborate data that was collected this far. This is going to be important because we'll be able to evaluate their outcomes and satisfactions. The next step will include redrafting the program to help fit the data that has been collected up until this point, and it will compare data after the change has been implemented with a positive correlation. The sixth step will involve the interventions and education that the healthcare worker must aim for, and it's possible these interventions may need to be adjusted in order of the findings throughout the process. As previously mentioned, evidence has shown that ERAS has many benefits, but a priority must be implemented. Just like the study performed by Polgrees and the American Journal of Surgery, I would expect for there to be a significant improvement when it comes to the client's understanding of their surgery and interventions. The hospital would develop its own study after reviewing already developed evidence-based research and analysis. Reviewing previous evidence-based resources may encourage staff to develop their own research regarding the patient outcomes with more education. With data collected for the proposal, most evidence shows surveys that are most effective, that surveys are the most effective method to collect information for an evaluation. Most of the data would be collected from the clients themselves. Although a huge barrier would be if they just didn't fill out the survey. They may forget, have a lack of time, or just simply don't want to fill it out. This would be one of the biggest barriers that we would come into contact with. Knowledge is power, and this is exactly why we want to empower our clients. we would want to reach clients with materials such as flyers, pamphlets. We would even turn this project into a journal, share it with nurses throughout the units, any unit that would affect that nurse. A policy would be another great way to bring out this proposal and bring it to life. We can start smaller with our own facility, make our way into the healthcare system with multiple hospitals, and eventually a statewide, then nationwide. A goal is to educate clients as well as healthcare professionals. Therefore, everyone is set up for success. Contact hours will be available for continuing education through an organization by showing positive patient outcomes with the most up-to-date information. During an interview with the supervisor of the operating room, Dee Altamirano acknowledged that there was a lack of education that she has seen in the preoperative phase. New information that was gathered during this interview was the preoperative unit is employed by a different company that is not Baylor Scott & White. This brings to the idea that the nurses in the preoperative unit are just not on the same page with the rest of the staff in the hospital. So this proposal may have an easier way to implement the education to other nurses simply by just informing them in case they didn't know that the hospital does abide by these ERAS guidelines. And in summary, this proposal concludes that a client satisfied when they are involved in educating in their surgery and their plan of care. Healthcare professionals have the power to help empower clients and provide them with all the education and resources that they need. By providing that education to our clients, they're going to feel more confident in their care. They're going to feel more at ease in trusting their healthcare professionals with their treatment and their plan. And the goal is to spread this policy to all hospital systems nationwide to help allow clients feel like they are in control of their health. These next 3 slides will be the references that were used for the purposes of this proposal. Second page and the third. And this concludes my capstone proposal on improving patient outcomes with education. Thank you for your time, and please reach out to me if you have any further questions. Thank you.